All right, we're back, Dr. Bunio. Hey, to the public, we apologize. We had some technical difficulties there. We're working with some older hardware here, and it's finally starting to fail on us, but we'll get that updated, and we'll work from our backup machine here. Dr. Bunio, are you excited to start over?
Oh, very much so.
For those of you that are at home and watching, please share this. Hopefully this one will stay up, and we can get a lot more views. You're laughing. This is exciting.
Mm-hmm.
So the COVID-19 informational hotline, I want to put this back up because we want folks to call this if they have any questions or concerns. I have concerns with is she leaving set here? 828-497-3743. We're trying to keep this as professional as possible today. Everything around us is going a little bit wild. Dr. Bunio, so where we left last time, we were kind of into our questions, and I had already gone through the Chief's executive order. I want to kind of start back with that, though, so that we can kind of catch up with what we were doing. The checkpoints in Cherokee are starting to be removed. Coming Friday, we're going to remove the checkpoints based on the order here. The curfew is going to be lifted. Church services can resume on Sunday, May 10th, at a limited capacity, 20% capacity. And one of the biggest things, one of the things we're talking about today, cloth face mask coverings will be mandatory in public spaces, including the church services. If you go out to the Food Lion, if you're going through any offices that may open up eventually, the face masks are going to be required. So I want to talk a little bit before we get into this about the face mask. I know that not everybody has one. If you don't have one, resources are being assembled right now to where folks can get a mask. We're working with our committees to kind of set up some events to get those out to the public. Again, why is it important to have the masks?
Well, as we said before, these cloth face masks protect the person next to you more than they protect you when you're wearing it. So if we're going to protect each other, then we all need to wear face masks when we're in those public spaces, especially where we can't guarantee that we're going to maintain that 6-foot distance.
Gotcha. So now if we have an elder or a grandparent that sends us out maybe to pick up some groceries for them, is it good practice to wear the mask not only while we're shopping for the groceries, but as we return and give the groceries back?
Yeah, that would be a good idea.
Okay.
Yeah.
The social distancing is a big thing as well. So again, that's the 6-foot spacing, trying to ensure that we're not too close to one another to spread the disease.
Right.
With the new order coming into place and economies and communities around us opening up, is that now more important than ever that we make sure that we stay distanced?
Absolutely. So now that things are going to be opening up, and we knew that had to happen at some point,
right? That
now we could be seeing more people coming onto the boundary who are coming from areas where they have more virus.
Gotcha.
And as we've talked about before, up to 25% of the people, they have the virus and they can spread it, but they don't even feel sick.
Yeah.
So it's not that they're doing it intentionally, but if they're here and they're not wearing a mask, they could be spreading it to people here locally.
Good. So the big message is here: keep your distance. Make sure we share with one another, support one another to get their masks and wear those out in the public, and to protect those most vulnerable to this disease at this point.
Yep, that's right.
Let's get into some of the questions. Again, I read this on Facebook about how COVID-19 was being blown out of proportion by the media, and that it's no worse than the flu. Is there truth to that, or what's your professional opinion?
No, I don't think there's truth to that. Now, early on, people were arguing that, hey, the flu kills more people than coronavirus.
Right.
And it's true that the flu will infect many more people historically, and it does kill people. But for the individual, if you catch this virus as opposed to the flu, the chance of you being hospitalized or dying is much higher.
Gotcha.
So this is a much more deadly virus. And as we can see, we still don't quite have it contained, and so that's why these precautions are perfectly reasonable.
Gotcha. Okay. Now, what is antibody testing?
Well, antibodies are what your body makes when you've been exposed to this virus. It's how we fight diseases. So antibody test is we get a sample of your blood and we look for antibodies that are specific to this virus.
Okay.
It takes your body about 16 days on average to make the antibodies, and some people who have very mild illness don't make enough antibodies at all for us to pick it up. So The test has very limited usefulness right now.
So does it mean if I get an antibody test and it shows that I have the antibodies, I can take my mask off and start going out in the public without the precautions like that?
No, it doesn't. We have seen some cases where people have caught this virus more than once, and so we may find later on that antibodies offer some protection. We just don't know right now.
Gotcha.
And this virus is so serious and deadly. It's just not worth the risk right now.
Okay, so we need to continue to treat it as the worst case scenario for that.
Yep.
What is the advantage of getting an antibody testing?
So if you get an antibody test right now with the level of disease we have, with the current tests that we have, there's about a 50% chance that it's a false positive.
Okay.
So you might as well just flip a coin if you get a positive test. And what does it tell you? It tells you that there's a 50% chance that you have contracted the virus at some point in the past, usually 2 weeks or longer. These antibodies may stay in your blood for up to 2 years. So we don't know when you had it. We just know that you've been in contact with it.
Gotcha. Okay. At what age should children start wearing masks or face coverings?
Face masks and coverings are not recommended for children 2 years and under.
Okay.
After that, you can try to get your 3-year-old to wear a mask. It may be challenging, but if you can make a bit of a game out of it, they might enjoy it.
And again, this is just for when they're out in the public or they're going to be maybe amongst their elders or their grandparents. This isn't just for casual home wear. This is
yeah, that's correct.
Okay.
Now children tend to not have as serious an illness. There are a couple of things showing up right now that seem to be more serious, but for the most part they're very rare.
Okay.
But if children get the virus, they can often be pretty asymptomatic, or they can just have a runny nose. So we think that children can spread the virus quite easily.
Right. Okay. So are all COVID positives enrolled members who live directly on the boundary? So this is, I guess, dealing with our numbers here, the ones that we're showing positive. Are they enrolled members who live directly on the boundary?
What I can tell you is about 10 out of the 15 positives that we've had so far are on the Qualla boundary.
Okay.
And we've had some in some of the outlying communities as well.
I got you. Okay.
So it's here.
It's here. I'm still confused about testing. If I test negative, can I be retested if I have concerns? And what's the limit on the retesting that I can do?
Yeah, you can be retested. So when we took that swab from your nose, that told us whether or not you had that virus in your nose at that point in time.
Right.
You could have caught it or still be in the incubation period. Theoretically, you could get tested, the very next day or 2 days later.
Okay.
There really is no limit to testing. At some point, it's probably not worth it if you feel well.
Right.
But if you got tested today and you were feeling perfectly well, and then you started to get sick and you started feeling a little bit short of breath, absolutely, we'd be happy to test you.
Okay, and so are there going to be standards created by maybe frequency of retesting for folks that are working in high traffic areas, for instance?
Well, we're developing a plan to test hospital staff periodically because they have the most risk of being exposed. And that's more of a surveillance thing. We want to make sure that we don't have someone working at the hospital. And by the way, at the hospital, we now have universal mask precautions. Everybody, staff, visitors, and patients are all being asked to wear masks.
Okay, great.
So if somebody's carrying it, they at least won't spread it to anybody else.
But there's no harm in setting up a personal schedule if you're working in an area right now where you may be having a lot more contact with folks. Let's say you're a cashier or something, where you could come every couple of weeks and get a test just to kind of keep awareness
if
of
you
where
wanted to. Yeah.
Okay, good. So there's no limit there. Are masks only good for those who are sick to help not spread germs? How will me wearing a mask and not being sick affect anyone?
Okay, so masks are for everybody. And again, it goes back to that 25% of people who have this virus and don't know it. We can spread this virus even when we're talking.
Okay.
Coughing, sneezing, it's really, we're shooting a lot of particles and droplets out that have the virus. Now, if you're wearing a mask and you're not sick, you're just protecting people just in case you have the virus and you don't know it.
Okay. And we've discussed this a number of times where we say we should assume that we have it, and we should assume that everyone else has it, and we should assume that it's on every surface.
For now, yeah.
Until we know more about it or start to eradicate it.
Yep.
Okay. Do we have any severe cases here?
So far, all the cases we've identified have had either mild or moderate illness, or the majority actually have been asymptomatic. They were volunteers who came through our testing sites. So when we were asking people to do so, and the chief sent out that request, let's just find out if it's in the community. So we had a lot of people come through who were not showing symptoms, and not surprisingly, the majority of our positive test people were asymptomatic.
Okay. What does a severe case look like?
Well, early on, we were seeing about 20% of the people needed to be hospitalized, and then another small percentage of that, usually about 4 or 5%, ended up in ICU, on a ventilator, on oxygen, and that's serious business when you can't breathe.
Absolutely. Okay. So, and that is independent of age as well, or health underlying conditions, right? Is that true?
No, it affect everybody. It could affect anybody, but statistically, the older you are, the more likely you're going to have a real serious case.
Gotcha. Okay. Are you still testing one person per household?
That's what we're recommending, and the reason for that is we've been doing pretty well with keeping up with our test supplies, but one person per household helps us to test a wider proportion of the community. So if one person in your household has got it or test positive, we're going to jump in, we're going to test everybody in that household, and we're going to do more focused testing. But one person per household is just a great way to see where it is.
Okay, good deal. And we'll continue doing that for a while, I'm sure.
Yep.
Can Cherokee County enrolled members get tested in Marble? Some don't have the funds or means to drive to Cherokee.
Yeah, absolutely. We are running testing days out in Marble and Snowbird, and I believe that gets posted. I don't have it with me just right now.
We'll share those again on the Cherokee Union Hospital Facebook page. We'll share the dates and times. There was some testing happening today. We had technical difficulties and kind of missed being able to bring that back up. We were testing today from 1 to 3, so there's still about an hour left in that. But also, I think there's a test. Is there another testing day on Friday? Is that right? Okay, so we have testing is available on Friday as well. And I don't want to misquote the time. I think it's like 9 to 3 as well. Is that 9 to 3? So, call the hotline and get you a test set up. Let them get ready for you. And then go up there to the drive-through testing area and get tested this week if you haven't already. One member of each of your household. Not one member of each. One member from each household. Yeah. Let me say that right. I haven't had coffee today, and I feel like that's kind of got me out of my game.
Mask,
I'm out of It's hard to drink it through my mask. Can anyone be tested at the testing sites?
Well, the purpose of us testing at the testing sites is to test members of this community, people that have close ties to this community. So we do have a criteria. We want to make sure that people can't be driving here from out of state to get tests. Of course, if they're enrolled members, we will do that.
And will this change when the border opens up?
Yeah, it will a little bit. We're just going to make sure that we are reserving the tests for this community.
Okay.
So we're going to be asking some questions about where people live and what ties they have to the community.
Gotcha.
To make sure that we have enough tests for everybody on the boundary and in the outlying communities.
Do you have the opportunity to do any kind of satellite testing? Like, can you move from there to the communities, or is it limited to just that area?
Yeah, we can. We can take our testing group on the road.
So as it needs to get more finite, you can get further into the communities maybe and just gather some of those homes.
Yeah, absolutely.
Okay, good. I'm not locking you into that. I'm just saying, is that possible? I might have signed you up for it.
Yeah, we'll be happy to do it now that I said we would.
With the borders opening back up, what can I do to stay protected?
So you keep doing what we've been asking you to do all this time, but it's even more important now, right? It's the masking, social distancing, and good hand hygiene. Don't touch your face. Right.
We're getting now to the area where it's like, you're getting ready to cross the road. You need to look both ways. Like it's starting to become common sense now that, and personal responsibility, as the chief has mentioned, that you kind of have to take care of yourself. You have to take care of your family, and as a community, we'll take care of each other. But it's starting to become the normal, right? I know that's probably our next question, but common sense now. Protect yourself and protect the people around you. And what can I do to protect my family more specifically?
Well, yeah, exactly what you were saying. You can protect your family by not bringing that virus home.
Right.
When you get home, you can wash your hands, change your clothes if you've been out, in public. So again, it's no different, but like you said, we're getting to a stage where some people might remember when you didn't have to wear a seatbelt. Well, now it's like you just get used to it. When I go out and I'm going out in public and I don't have my mask, I don't feel right anymore.
Gotcha.
And I think that's where we're going to get.
And that leads to our next question here. What is the new normal?
Yeah, the new normal is doing all these things that we've talked about. We're doing a lot in healthcare to do a lot more remote healthcare. We're calling people. We're using telehealth, which is an audio-video feed. And we're finding that we can do a lot of stuff differently but still keep people safe.
Good.
So, things are going to be changing. This is the new normal.
Right, and governmental workspaces eventually will reopen, and we'll be dealing with the public one-on-one. Well, a lot of that's going to look different as well, and the suggestions that are coming from the health departments are saying, like, there's going to have to continue the social distancing, the mask wearing, the limited interactions, the wiping of the surfaces.
Yeah.
That's the normal, right? Is that what we're going to start to face for a while?
Yeah, until we get this virus under control, or we have a vaccine, or we see that it's on the downslope.
Right.
That's what's going to happen. We're talking about opening up more services. I know that they're going to start doing more surgeries at Mission and DLP,
Okay.
and they're going to do a lot of stuff. Testing people and asking them to self-isolate before they can have surgery. So
Good. Okay. Well, that I guess that's the end of our questions. Shashi, did we get any remote questions while we were online here? We don't have any from the public. Nobody, was anybody watching this? Is there anybody out there? Well, we certainly appreciate Dr. Bunio being able to chat and take questions from the community and hope to ease some fears and to answer some concerns as we start to live in our new normal. Really challenge the public to come out and be tested. One person from your household, come get tested. Helps us kind of see the map of where this might be or where it's at. Don't panic. Just continue to be safe and practice safe hygiene and keep this thing out of your household as much as possible. If we have any more updates, I don't know that we're going to be on a regular schedule from here on out, but if things change, we'll certainly be back on. And we'll share that with the community. So we hope you enjoyed, and we'll talk to you again soon. Dada Dagahi.